Hello, my name is Lindsay Franklin. I am the Director of Operations for the American Board of Urology. We look forward to welcoming you to the 2026 Certifying Part 2 Oral Examinations in Raleigh, North Carolina. The 2026 oral examinations will be administered on Friday, March 20th and Saturday, March 21st at the Ames Center in Raleigh. You have been randomly assigned one exam date and will participate in either a morning exam session or an afternoon exam session. Exam assignments were distributed via email on December 31st. Each examination will consist of two 45-minute sessions with different examiners, separated by a 10-minute break during which candidates will transition between halls. The exam will include three clinical scenarios on the standardized oral exam SOE hall and three objective structured clinical examination OSKEs on the OSKE hall. On the SOE hall, candidates will complete three 8-question protocols with 15 minutes allotted for each. On the OSKE hall, candidates will rotate through three stations where you will complete one professionalism OSKE, one imaging OSKE, and one diagnostic simulation OSKE. Candidates will have 13 minutes to complete each 5-question OSKE. For each of your 4 exam encounters, 2 examiners will be present. Both will independently score the candidate's performance. On the day of your exam, whether you are staying at the Renaissance or not, you are required to report there prior to your exam session. If you have a morning session, a 7 a.m., 8:50 a.m., or 10:50 a.m. start time, you will report to the salon ballroom at the Renaissance 30 minutes prior to your exam start time. For afternoon sessions, 1:30 and 3:40 p.m., candidates will report to the salon ballroom at the Renaissance at 12 p.m. A box lunch will be provided at check-in. At check-in, you will receive an ABU ID badge, which is required for admission to the exam. The badge will bear your photo and candidate ID number. On the back of your badge will be a label bearing your name as you indicated on your Part 2 application. This is how your name will appear on your certificate when you complete the certification process. If you would like your name to appear differently or need to change something, please let one of the ABU staff know. The ABU staff, guides, monitors, and security personnel will be verifying your identity throughout the exam. So please be sure to wear your ID badge around your neck whenever you need to report for your exams and during your sequestering period. At the start of each exam session, your examiner will ask that you read aloud your ABU ID. Your ABU ID is located on your badge. All candidates will be escorted to their oral exam encounters by a guide from the ABU staff. Shortly before your exam period, guides will enter the ballroom and announce a list of candidate numbers. Please listen carefully for your ABU ID number. Each guide will be taking a group by shuttle to the AIM testing center just a few minutes away. When you hear your number called, please assemble with your guide, who will then escort your group to the shuttle and to the AIM testing center. Upon arriving at the AIM center, you will be directed straight to an exam room to begin testing. Immediately following your first exam session, you will exit the exam room and report to a holding room where you will check in with a monitor. Here you will have a brief break. At the start of your next exam, a guide will escort you to your second exam period. At the conclusion of your second exam period, you will once again report to a holding room. Once your group has reassembled, your guide will escort you back to the Renaissance. Morning exam groups will be sequestered at the Renaissance until approximately 12:30 p.m. and then released. A box lunch will be provided. Following each afternoon session, candidates will be escorted back to the Renaissance and free to leave. At the start of your examiners will provide you with a paper case summary for each protocol and OSKE. The summary will include details relevant to the case scenario. You are permitted to write on the case summaries. Paper and pencils will be available for your use in the examination room. You may take notes or make calculations during your oral exam on that paper, and you must leave it with your examiner at the conclusion of your exam. You may not bring your own writing implement. In addition to the case summary, your examiner may share images relevant to the protocol or OSKE. The board has established rules regarding appropriate behavior during examinations so that they are administered in a fair and impartial fashion. You may not bring personal items, papers, notes, or study materials of any kind with you to your sequestering or exam times. Absolutely no electronic devices are permitted. You may not wear a watch into the sequestering room or exam room. All briefcases, luggage, etc. must be left in your room or checked with the bellman of the hotel when you report to your exam. We have secured a luggage hold at the Renaissance for those checking out and departing shortly after their exam session. Please do not be noisy or disruptive in the exam areas. Do not cause distractions. Please do not discuss any of the content of the exam with anyone during your oral exam. Please do not share information about the exam content following the exam. You may not retain any notes taken during your oral examination. You may not remove exam materials from the exam rooms. Please do not discuss or disclose the content of the examination to others or reproduce any portion of the exam in any manner, including reconstruction through memorization or dictation. Your cooperation in refraining from all conversation about the exam in between sessions will help maintain a proper testing environment. Recording, transmitting, or transcribing any portion of the exam will result in invalidation of your exam, forfeiture of your registration fee, and permanent ineligibility for ABU certification. In addition, the ABU reserves the right to prosecute those responsible under all applicable state and federal laws, including but not limited to copyright laws. If you have a problem or a situation arise during the exam, please talk to ABU staff about it. If we can assist you, we will make every effort to do so. Please recall signing a confidentiality statement with your online application. Additionally, you have authorized the ABU to record the video and audio of your exam sessions for educational quality and scoring purposes. All examination-related data are the property of the ABU and remains confidential. Videos may be used for the purpose of quality control and research to improve the examination, methodology, and delivery. Such recordings will be retained in accordance with the ABU retention policy. Results will be posted to the candidate and diplomate portal approximately 3 to 4 weeks following the exam. We will notify you by email when results are posted. On behalf of the ABU staff, we wish you a successful examination experience. Our goal is to give you the best opportunity to showcase your ability to manage clinical problems. We know what you have invested in your training and in the certification process, and if we can be of any assistance at any point, please let us know. I would now like to introduce the oral examination chairman and ABU trustee, Dr. Chris Gonzalez.
Well, I want to welcome everybody. My name is Chris Gonzalez. I'm the outgoing chair of the Oral Examination Committee. We have Dr. Sam Chang, who's the incoming chair. So, what we'd like to do is talk to you a little bit about the certifying exam, give you an overview, maybe some nuances of it, and then leave plenty of time for questions. And hopefully, we can get a lot of your questions that were asked answered in this particular talk. So as Bruce was saying, the AUA is a trade organization, so deals with education, research, advocacy. The American Board of Urology, the number one thing is for the mission for the American Board of Urology is to act on the benefit of the public and really to protect the public. And the way we do that is through certification of candidates who are going to practice safe urology and the highest quality of urologic care. So the way we do this is we establish and maintain standards of certification of urologists, and you're seeing the final step of that right now. So I think you're also too familiar with this, but this is a certification process, which can take up to 6 years. Most times it does not take that long, but you can go to the far left and you complete your residency when you then become board eligible, pass the qualifying exam. Then you got some requirements to take for the certifying exam. You can see what those are down there: 16 months in practice, log review, complications narrative, peer review, unrestricted license, professional responsibility, and action history. We then know that you're eligible to sit for the oral or the certifying examination. And you have 3 times to take it. You won't need all 3 times, but you do, and you just want to make sure it's in that six-year window. So what's the purpose of the certifying exam? Well, we want to see your ability to gather information relevant to a clinical problem, manage clinical problems effectively and safely, right? And a real emphasis on safety, React in a timely fashion to complications. So you'll see things turn in your scenarios where you'll get a complication. Show communication, diagnostic, and technical skills. And we'll get into that a little bit later with the OSKEs. And really want you to act in an ethical and professional manner. So the generality of this is that you'll be given pertinent clinical information at the start of each protocol or OSKE. You'll be asked to interpret tests or images, discuss surgical techniques, manage complications. So you'll be given a complication, how you manage it will be important, and then interact with surrogates for patient, family, and members on the exam. So the process is a case scenario will be handed to you at the start of the protocol or the OSKE, either or. You can write on the summary, pencil and paper will be provided. If there are laboratory values during the protocol, normative values will be given. So don't worry about having to memorize normative values, okay? The test results, images, and video will be released to you at certain points during the protocol. You'll have a chance to take a look at it, digest it, and then come back with your answer and what is asked of you. And the examiners will move you along so you complete three protocols and three OSKEs in the allotted time. So there's questions about timing, and really the examiners will keep you on time. There's a clock in there, and that's the number one thing is just to keep moving along. So again, if you don't know something, just move on because every point counts. So if you're worried about a point that you may or may not get, think about the next points. And really the overall assessment of the protocol or the OSKE is worth more. So it's important to get through these and get them finished. So why do we use OSKEs, objective structured clinical exams? Well, this is called Miller's Pyramid, and it shows how to assess competencies. If we start at that very low level of fact recall, that's multiple choice questions. So even though we give those to you on the written exam, it's probably the lowest level of assessing competency. It just shows that you know. If you go right to the top of that pyramid, it does. That's actually watching somebody in practice and watching what they do. And that's not feasible, obviously, for us to get out and take a look at 330 candidates. So, but that's the gold standard. So when we start talking about standard protocols and OSKEs, they're right in the middle there. So the standard protocols are the case presentations that you're going to see are going to be knows how, and then the OSKEs are one rung down from does, and that's shows, and that's going to be also simulation, which we'll talk about as well too. So it's just one layer high, one level higher, but being able to assess your competency and get a better idea of who you are and your competency, and that's the reason why we've chosen to do OSKEs. So you'll get three OSKEs on this examination, okay? One will assess your professionalism and communication, and you'll interact with a simulated patient who will be one of the examiners. So two examiners per room. We used to use professional actors. We have moved away from that now. We tested that at the last exam, tested real well that the examiners did a nice job. So that's the direction we're going to go in. Um, but you'll interact with that examiner as a simulated patient. The second examiner will give you introductory statements and instructions during that OSKE. The second OSKE will involve real-time use of a diagnostic study. You'll be asked to interpret a study, direct an intervention. That could be a video, could be a radiograph. Okay. And then the final OSKE will be a simulated model of the male lower urinary tract. You'll be asked to perform cystoscopy and identify relevant findings on this. So once you are done doing the procedure, you then will be asked relevant questions regarding the cystoscopic assessment and the findings that you had. So again, there'll be three OSKEs, about 10 to 13 minutes each, and you'll go right to the next station and then complete that entire OSKE module. So here's what we're looking at. This is a biogel phantom, is what it's called, of the male lower urinary tract. You'll be given a flexible cystoscope. You'll have a chance to acclimate yourself to the flexible cystoscope, and that'll then be placed through the simulated penis and into the lower urinary tract. And you can see that's the apparatus, and we've gone at length to make sure nobody gets one drop of water on them. Obviously, we're going to be watch that very carefully. There's a side view with the video monitor above, so you can see that. You'll be standing, and then you can see to the right there that there'll be findings that we will ask you to identify once you look in. So a summary of the certifying exam for this year is going to be you're going to work through three standard protocols of 8 items each, be about 45 minutes. You will then have three different OSKEs of 10 to 13 minutes each, professionalism, diagnostic, and simulation. And again, that's going to wind up being about 3 times 13 and be about 40 minutes, 45 minutes. and then there'll be a short break in between one or the other of these, whichever ones comes first for you. So somebody had asked about the number of examiners, so it's a great question. So for the standard protocols, you'll have two examiners for all three standard protocols. For each OSKE, you'll have two different examiners. So for the professionalism OSKE, you'll have two, diagnostic, you'll have two, and simulation, you'll have two. Those examiners will only grade the ones that you were tested on. So there'll be a total of eight different examiners. So only two examiners in the room at once. There will not be, there's a question about having four or five. There's only going to be two examiners in the room at once. And again, one examiner will be delivering each protocol on OSKE. Examiners will not switch back and forth to make it confusing for you within a single protocol. And both examiners in the room will score the test they gave for the test that they gave. The examiners are blind to your training, your part one score, uh, any practice patterns, location where you're at, anything like that, they're blinded to that. And the examiners are queried prior to the exam to ensure that they don't know you. Okay. Examinees will be asked prior to the exam if they have a close relationship with the examiners. So, training program, visiting professor, research. So, you please want to disclose that if you do have a relationship with an examiner. It's important to know these examinations will be recorded, and that's just in case there's discrepancies in scoring between examiners. The recordings are destroyed once the results are released, and those results are released about 4 weeks from the date of the exam. Scoring is done on a point system within each protocol in addition to an overall assessment. So, again, if you fail to answer one section correctly, it does not affect the next. So, keep moving forward. Keep accumulating as much points as you possibly can. The scoring is objective and highly reliable. Year to year, it's very consistent and very reliable. The difficulty of the examiner is also not a concern. These exams, we're going through the same template. It's the same script for each of the exams. So they're fixed, objective, and clearly identified in the scoring rubric. So again, if one examiner may be a little bit more harsh, that will be corrected for, and you'll go from a raw average to a fair average where it will be adjusted. And this ensures that the scores are not biased by different facets of the exam. We'll be at the Ames Center about 10 to 15 minutes outside downtown Raleigh. It's also home to the American Board of Anesthesia. It's our fourth year that we're going to be there. And the candidates will stay in a hotel about 5 minutes away. There you can see the room that you'll be in for everything but the simulation room. So you have the two examiners on one side of the table. You'll have that'll be your chair, and then you'll see the computer there where you'll be able to see the videos or radiographs. You'll be bused to and from the Renaissance to the center. The morning candidates must report 30 minutes prior to the exam, and all morning candidates will be sequestered until 12:30 till everybody is done. The afternoon candidates will report at 12, and box lunches will be provided. And this will all be set up for you. So it's important to know that you to give us comments at the end of it. We do read through the comments. So the feedback is very important. And you think about your feedback, it's led to no more hotel room exams, condensed exam schedule to 1/2 day. Before it used to be 2 full days. I remember. I mean, when Dr. Chang and I took the test, it was 2 full days. So now it's down to 1/2 day, which I think is a little bit more manageable. The question, protocol, and examiner difficulty is adjusted to the fair average. And this is to eliminate scoring biases of if there's a really hard question, that'll be corrected. If there's a really hard protocol or there's a really hard examiner, these things will all be corrected to get to a fair average. And no more virtual exams. So words of wisdom. If you don't know a particular question, again, just keep moving. I know I've said that multiple times, but extremely important just to keep moving. Your examiners will also be instructed to move you through the exam. You may come to a part when you realize you don't have something answered, or you think maybe you got the correct answer. Don't worry about it. Again, just keep moving. Don't say, hey, let's go back 2 questions ago. I finally got the answer for that. Usually doesn't work that way. It doesn't work very well that way. So just go ahead and keep moving forward. Maintain professional behavior at all times. If you need a timeout, tell them. You need a minute. There's nothing wrong with that. But this is really the only time the examiners will get to know you, and you are being graded on your professionalism. There's something about the attire to wear, and it's usually we ask for business attire for this examination. And then the overall assessment score for each protocol carries more weight than the individual sections as mentioned. So that's why it's really important to get through the examination. So keep pushing forward. So this is the exam results from the last several years. So if we can focus in on 2022 through 2025, 97% pass, 99%, 95, 95%. So a very, very high pass rate. You're all going to do great on this exam, and we're here for you to help you. Please ask us any questions that you have, and I wish you the best of luck.